Welcome back to our 5th health education video. Today we will be talking about mental health. Dialysis is a life-changing event that can create an overwhelming amount of stress for a dialysis patient. Facing end-stage renal disease can be scary enough, but many patients may also cope with financial and insurance issues, juggling dialysis schedules and work, unsupportive family members, concern of physical pain from dialysis, and fear of death. People with chronic kidney disease and their caregivers often develop depression due to the difficulty of coping with all of the life changes that accompany end-stage renal disease. If you are a patient or caregiver experiencing depression or are having difficulty adjusting, there is hope. Treatment and relief can come in many forms. Depression is much more prevalent than people think. Anyone can suffer from depression, not just those with chronic kidney disease or who are on dialysis. Depression is an illness that should be treated by a professional in the same way you would treat diabetes or high blood pressure. Having depression in no way implies that a person has flaws in their character.
Seeking professional help. Depression can mimic the symptoms of many other illnesses. Only a qualified professional can make a diagnosis based on the description of your symptoms. Have you been experiencing any of the following? Constant sadness, especially when circumstances would lead most people to be happy. More difficulty than usual with making decisions. Easily upset and or more irritable than usual. Being tired all the time. Sleeping more or less than usual. Waking up early in the morning if this has not been your normal routine. Not wanting to eat or wanting to eat more than usual. Constant thoughts of death. Seek professional help immediately. If you have experienced any of the symptoms above, talk with your nephrology social worker and your doctor. He or she can determine if you are suffering from depression or if there is some aspect of kidney disease that should be treated. The most dangerous feature of depression is that if left untreated, it can lead someone to be suicidal. If you ever have thoughts that you would be better off dead than continuing to live, please tell someone. People and places you can turn to for help include a healthcare professional, your caregiver, your spouse or significant other, your religious leader or pastor, a trusted friend or family member, the suicide hotline by calling 1-800-SUICIDE, and emergency response by calling 911. Keep telling people until someone listens to you and helps you. This could save your life.
Depression is typically treated in one or a combination of two ways, with medications and or with psychotherapy, also known as talk therapy. Medicine is most successful when used in combination with counseling or other support. Medications can only be prescribed by a qualified doctor or nurse practitioner. Psychiatrists are physicians who have specialized knowledge and training in the use of medications to affect what is going on in the brain to cause depression. It is always best to check with your nephrologist before seeing a psychiatrist, as many medicines used to treat depression require dosage adjustments for those who are at end-stage renal disease. Medications are effective in treating chemical imbalances in the brain that can lead to depression. Some antidepressants do, however, take a few weeks to start helping you feel better. Psychotherapy, or talk therapy, involves a series of meetings with a mental health professional who can be psychiatrists, psychologists, social workers, nurses, or counselors. There are many different approaches to psychotherapy, and most therapists are skilled in determining what will be the best one for you.
Remember, you are not alone in your struggles with kidney disease and dialysis. There are people in the community who meet periodically to support each other. Talking to others who are also going through chronic kidney disease or dialysis can be a much needed opportunity to vent, share information, get advice, and receive and provide support. You could also contact your nephrology social worker for other support groups that may be available in your community or at your clinic. Resources to find support include DaVita.com forum, National Kidney Foundation, American Association of Kidney Patients, Renal Support Network, Kidney and Urology Foundation of America, and Dialysis Patient Citizens.
Thank you for joining us again today. Remember, your mental health affects your physical health, and help is available to both people with kidney disease and their caregivers. Your nephrology care team, including your social worker, is available to provide support to renal patients and caregivers. If you feel you are experiencing depression or difficulty coping, please contact your social worker to further discuss the treatment options available in your area. We look forward to having you join us for our next video on patient advocacy. Joy, sorrow, tears, lamentation, laughter. To all these music gives voice, but in such a way that we are transported from the world of unrest to a world of peace and see reality in a new way. Albert Schweitzer.